So this time we've got some kind of seating for everybody. If you want to sit up at the front, you can. You want tables in the middle, you want round tables at the back. Something for everybody. Hopefully we've addressed all of your needs. And also surprised, whether we have a bright sunny day or we've got a cloudy dreary day, our room keeps getting fuller and fuller and fuller. So it's just keeps reminding me, and I guess all our educational partners, that we're here for you and that there's clearly a need. And so as long as you keep coming, we'll still be here offering the services that we provide. Who here is here for the first time? Any newbies? Quite a few. Welcome. I hope you find today's session informative and most importantly empowering. That you come away with some information that you weren't aware of when you arrived, and that you're always welcome to come back again. And just a warm welcome to everybody who's been here before. Clearly you have found that it's been worthwhile, and we're glad to see you here again today. So just a bit about me. I'm Marion Gord. Actually, I'm supposed to be doing this too. Jeanette, here, you can do that. Sorry, I'm Marion Gord. I'm a real estate broker here in Burlington with Keller Williams Edge Realty. And my specialty is working with older adults and later in life moves. And so it's because of my experiences in the work that I do that I recognize that there is need, and you're demonstrating that that's the case. So a later in life move, it's not really about the real estate piece, it's around the life transition. And so it often involves lawyers and financial advisors, downsizers, transition specialists. So in my business, I have connections to all those types of services. And so real estate is maybe the hub of it, or a piece of it, but that's not the end of it. And so I'm passionate about what I do, as are the other, the educational partners that are here. Oh, sorry. We need to turn it on. There we go. See? Okay, we're good. Technology is always such a treat. So I just want to also acknowledge the educational partners that helped to put this event together and make it available to you for free. They're all in the room around me. I'll start on this side. We have Meredith Joachim. Her alias is Rob Hamilton. She's with Hearing Well Matters, but obviously their business name speaks for itself. Next to her, Denise LeBlanc, Arbor Memorial. So any of your pre-planning and funeral service needs, she can deal with very aptly. Beside her is Irene Zioba for 360 Downsizing. So Irene is the girl that you want to talk to if you're wondering about what to do with your stuff, how to get organized, can help you move from one home to another, aside from the real estate piece, just talks about the stuff. Beside her, Carrie Porter from Oakville, Oakville, one of the retirement homes. We'll be maybe referring to you a little bit later. On the far side, Sarah Sachs, Smith's Funeral Homes, same kind of role as Denise, pre-planning, funeral arrangements, well-known name in our community. We also have Jerry Tzia. He's not here today, or he's running a little bit late. Qualicare Burlington, so any home care services that you need, he's one of many agencies in our community that provides home health care. Kim Routledge is on our panel today. She's with Vistamere by Fieldgate, a retirement home in Oakville. And Jeanette Bock is also one of our educational partners from, you tell me the name again? Senior Transitions. I can never remember whether it's Senior First or Food First. One of these days I'll get that straight, but thank you very much. Anyways, these folks here are all committed, passionate, experienced, and caring. And often, online, there's lots of information, lots of places you can go to get information today, but you never know who you can trust, who's telling you the truth. So I can vouch for all of the people that are here. You won't go wrong with any of them. And perhaps you don't need their services today, but I think an underlying message that you're going to hear every month that we're together is to plan ahead. So if you don't need them today, it certainly would be wise to talk to them today so that you can at least be put on the right path and maybe learn what you don't know. Just moving on. So today's topic, Oh, sorry, before I go on, I just also wanted to thank Ida and Lisa. Where are you, Lisa? Thanks very much. They're the girls that helped us put this together and make sure everybody gets that. Thank you. So once again, today we've got a full session, lots of information to share, and just a few little housekeeping tips before we start. I just appreciate if everybody could make sure that their phones are turned off so that we don't have those types of disruptions throughout. We have a lot of information. We've got 5 panelists and sure lots of discussion, but we do plan to get out of here by 3 o'clock. If you do have questions along the way, you can either jot them down. If they're pressing, raise your hand. We'll do our best to answer any of your questions. But the notepads are there just to make sure that you don't forget what you wanted to ask. If you have an opportunity to ask a question, I just ask that you do please speak up, and then we will do our best to make sure that everybody in the room hears it. We don't want to have any private conversations. Your handouts have the information of all our educational partners, and on the back, the contact information for the panelists. So you will have that at your disposal. And also just, if you've checked in and you did come in through that door, or if you've arrived and did come through that door, I'd really appreciate if you could just make sure we have record that you're here and your accurate contact information. I just fret all the time that if I had to make a last minute change or something and I couldn't get in touch with somebody, that I would be putting you out on the street or inconveniencing you in one way or another, and I just wanted to avoid that, so please do that. Okay, so almost. We're here to learn about retirement communities and whether or not they're all the same. And the short answer is no, and you'll hear more about why along the way today. But in general, the environments are different, the characteristics of each community is different, the services that they offer are different, and our panel will help make that clearer to you. So Jeanette Bock, owner of Fluid Senior Transitions, is going to facilitate our conversation this afternoon. And Jeanette is a professional consultant who's passionate about helping seniors and their families through challenging times after she experienced a crisis with her own father 10 years ago. It was life-changing and led her to change her career path to make a difference in the lives of seniors. She brings 30 plus years of customer service and problem-solving experience to her role, and she worked in retirement living for a number of years, then was offered a position in a geriatric care management company, where she worked for 3 years helping seniors out of crisis situations, then decided to round out her career or experience by working in home care. And then a few years ago, Jeanette has started her own company, Fluid Senior Transitions, where she puts all of her knowledge and past experience to work for her clients. So you'll be in good hands with Jeanette. She knows her way around retirement living and communities, and we'll take it away. Thank you.
Thank you, Marian. Now that I know how to use it, we'll get it upside down. So thank you for joining us today. So Marian asked me if we could put something together and talk about retirement living. And many of you are familiar with the regular retirement living communities, but I wanted to take this opportunity to expand on that a little bit. One of our speakers wasn't able to come today, and he represents Sparrow Living, which is a home sharing concept. I'm not going to talk about it, but if you are interested in learning more or checking out their website, it's sparrowliving.com. Okay? But I have a fabulous group here. We're going to talk first it's actually Lindsey Burns. So I had here Mohammed, but Mohammed wasn't able to be here today. So Lindsey is here instead, and Lindsey is fabulous. So we'll start off by speaking with Lindsey about something the company is called HomeCare Hub. Very different than what you would ever think of as retirement living. I'll let her explain.
Okay. Oh, there we go. Do you mind if I stand up? I'm a short person and I want to be able to see you all. As Jeanette said, I'm Lindsey Burns. I'm here for HomeCare Hub. I am a registered nurse by training. Like Jeanette, I've worked in hospice, home care, rehab, a lot of different sort of aspects of care for seniors. So, and my career has been focused on helping patients transition to the right level of care and also keeping them healthy and at home as long as possible. So, HomeCare Hub is not like a traditional retirement community. We are the brainchild of our CEO, Dr. Vipin Nakor, who is a physician in Mississauga and Toronto, and he kind of set out to solve the crisis of senior care. Especially, it's already a struggle for so many people, and we're only expecting it to become more challenging in the next 10, 20 years. So what we do is we have software and algorithms that match individuals who are looking for care services, usually between about 2 and 15 individuals, on average probably in the 5-6 range, according to what their care needs are, what their cultural preferences are, their language preferences, other sort of hard to pin down factors, where they want to live, that sort of thing. And we create small shared care homes. Our focus is on doing this, with exceptional quality, and on average, it's about, the residential assisted living is about 30% less in terms of cost than traditional options. There's a big range. I think the slide says somewhere 25 to 75% generally reduced cost, depending on lots of factors. But so what we do is we take your information or your loved one's information, find out what your needs are. And if those needs match with an existing care home that we have in your community, then fantastic, that's a place for you to go. If it doesn't match with something that currently exists, we have developer partners, and we are able to very quickly either turn on sort of existing property that we have or rent and retrofit, new property to make it accessible, that sort of thing. So typically in less than a month or so, we're able to have, even if we're starting from scratch, to have a place for somebody to go. So on top of having the accessible housing, that kind of thing, we layer on care services. So whether that's caregivers, that can be very little care, for some people it's just sort of independent supported living, all the way up to 24/7 care for people with very, very significant medical needs. So we provide that in the home. We have nurses like myself or physicians on staff who are able to layer on top, medical care and supervision. We don't intend to replace anybody's existing relationships with their doctors, but we can provide an additional layer of support. Sometimes you need something right away, and that sort of thing. We layer on technology, like fall prevention technologies, different things, depending on what people's needs are. We provide meals that are personalized, so our caregivers will sit with residents and make the grocery shopping lists for exactly what it is that they want to eat. And so programming is all tailored to those specific individuals and what their needs are. Yes.
Are you a business, or do you work with the retirement homes presently? And if you are a business, where are you?
Yes, so yes, we are a business. Our headquarters is in Toronto. We operate all throughout the GTA, also other parts of Canada, even in the US as well. So we're not connected to a specific retirement home. The goal for us is and we can provide care for people who need long-term care. This is their home where they wish to live, and we can help them to age in place, right? So we can increase care needs if their needs, increase over time. But we also sometimes have residents who are, let's say, on the waiting list for long-term care, and they need a solution in the meantime. They need care, and so sometimes we'll have those residents come and be with us, until they get a bed, you know, somewhere else that they're waiting for. The basic idea is that everything is sort of hyper-personalized. We provide very high quality. That's, I think, as Marion alluded to, you know, one of the concerns for anyone going into a home or a facility is always quality. And so one thing that's really important to us is that residents can know that if they're going into one of our homes, it is high quality. So we have homes on our platform. Some of them we run, some of them are on our platform as partner homes, but they're run by like a nurse that has that home or that sort of thing. But we vet all of them. There's a 400-point checklist to validate that that's a high quality home that's providing high quality care. And if they're not, if that changes, we take them off the platform as well. So the idea is that we are sort of the supervising organization, and that if you come into one of our homes, you know that that is, that's a high quality place where you'll receive good care, good, at an affordable price, and good meals and personalized programs. Yes, sir.
Are you inspected, and how many times a year would you be inspected?
So small residential assisted livings here in Ontario are not inspected. So that is again part of the reason that we step in order to be that quality layer for residents or patients, and to validate that home we inspect. We provide that quality layer, but Ontario does not have that requirement. There are other places that were operational. For instance, in Wisconsin, they do have inspections, and so there are homes there are all inspected, but not in Ontario.
So who is it that keeps you on the ball and keeps your residents happy? And the families.
Yeah. So our patients, right? We are currently we're growing, and we're growing because we do provide that good care, and the patients are happy, and because we have our residents come in, and it's a month-to-month agreement. So if anybody weren't happy, they haven't spent a ton of money, they would just go elsewhere. But yeah, and that's why we have nurses on staff like myself, and physicians on staff, and all of that to provide that that level of supervision.
Thank you, Lindsey. I just wanted to also just explain, Dr. Vipin Nakori, when you meet him and you understand his vision and his experience, I think you'll end up finding that you're feeling much more comfortable. It is a new concept, and for that reason, it's hard for all of us to get our heads wrapped around. But it is a great option for somebody that has high needs or dementia and needs or prefers a smaller environment and not a congregate living setting like many of the retirement living communities. So I would suggest, if you're interested in this home care hub, that you speak with Lindsey afterwards and get more information, because it does take a little bit to kind of get your head wrapped around, but it is an excellent option that's starting to become a little bit more mainstream.
There are a lot of places in, some in Canada, some in the US, where this is a very mainstream idea. This has been studied over the last 30 years. The Greenhouse Project does a lot of these. And they have shown that these good quality residential assisted livings do provide better outcomes at an average of 30% lower cost. Probably partly because it isn't a large institution, the caregiver doesn't have a whole hall perhaps, or just has a few patients to take care of. So yeah.
Thanks, Lindsey. We're going to take questions at the end. Sorry, we're going to take questions at the end. So we're going to move on. I've given them all 10 minutes, so that's why I'm being really keeping my eye on things. So the next one we're going to hear from is Vistamere. This is Kim Routledge. She's a sales consultant at Vistamere, which is located in Oakville. So I'll let Kim take it away and tell you all about it.
Thank you very much, Jeanette. Good afternoon, everyone, and thank you so much for joining us today and allowing me to be here and share our information about our wonderful community at Vistamere in South Oakville. Just a little bit about myself. I started out in retirement living just about 23 years ago, and I did this because I too helped a loved one in my family, my Auntie Doe, transition, and I thought there's a lot of education and support for seniors out there, and I wanted to make sure that I was one of those people that was out there helping them, learning about the transition and how to connect with the right people in order to find the right support. So I joined Vistamere in July of 2023. Vistamere is a property that has been existing in South Oakville since 1987. And just recently, Vistamere joined the Fieldgate Retirement Living family in May of 2023. So during this time, Fieldgate started on some wonderful new renovations in Vistamere in July. And the residents are very proud and excited to share with their families and the community all the new improvements. So Fieldgate Retirement Living specializes in the development, construction, and management of high-quality retirement residents at desirable locations across the GTA. With a wide range of retirement living options, including independent and supportive living to seniors, apartments, and respite stays, Fieldgate Retirement Living ensures its residents have all they need to live to the fullest. Fieldgate Retirement Living aims to set a new standard of exceptional senior living with an emphasis on fun. Vistamere Seniors community is scaled to be intimate and cozy. Vistamere is 94 suites, so it's a very small community feel. In a 2-story senior residence, we offer a wide selection of independent suites and unit types, many with their own walkout patios and into our courtyard gardens. Families can choose from a variety of senior living studio, 1-bedroom or 2-bedroom suites, each with their own kitchenette, large bathroom, and ample closet space. And we all know how important those closets are. So Vistamere offers more than just a place to live. It provides a true sense of community and history. Situated in the picturesque residential area of South Oakville, this charming neighborhood has been a beloved home for many families over the years. Its rich heritage, once served as a school in the 80s, evokes nostalgia for those who have connections in the past. It's not uncommon to meet prospective residents who fondly recall their children attending the EA or school, or even individuals who once worked within the very walls of the building. What sets Vistamere apart is that it has a dedicated staff, many of whom have been a part of this community since its inception. The familiar faces not only bring a sense of continuity, but also a deep-rooted commitment to creating a welcoming and comfortable environment for all residents. This continuity of care and connection to the past further enhances the feeling of belonging and nostalgic that permeates throughout Vistamere, making it a truly special place to call home. By choosing a community that offers services like meals and housekeeping, these families are prioritizing their well-being and creating a lifestyle that promotes relaxation and enjoyment. The shift in focus from chores to shared experiences can enhance their quality of life and strengthen bonds within the community. It's a testament to the value of coming together and supporting one another and creating a fulfilling and comfortable living environment.
Thank you, Kim. So I wanted to point out that there are a variety of different levels in retirement living. So as Marian mentioned at the beginning, not all retirement livings offer the same levels of care. And those are questions that you need to ask when you do a tour. What's the level of care? But also understanding some of the terminology. So we'll hear about independent living, independent supportive living. Next up will be assisted living, and then we'll get to memory care. Yes, I got a question.
could you move that way? You keep migrating and getting out of the video. Thank you.
You're welcome. So I also, at this point, I also wanted to just draw your attention to Carrie Porter is here from Chartwell of Oakville. And that is an independent supportive living building as well. So that means that they do provide meals, they provide housekeeping, and they do provide levels of care, okay? But there is a difference about supportive living and assisted living. And I'm gonna let our lovely Sarah Pollice from Sunrise talk about assisted living.
Yes, good afternoon. Thank you, Jeanette. Thank you, Marion, for having me here this afternoon. My name is Sarah Pollice, and I'm the Director of Sales at Sunrise Senior Living here in Burlington. And yes, Jeanette nailed it right on the head. As we know, there's retirement living, and there's a lot of different options under that umbrella. So I'm going to speak to you about really we are that next level of care when it comes to your more independent, supportive, and now that assisted living environment. And that's what Sunrise is. Sunrise is a 64-unit, small-knit community here in Burlington that offers assisted living and memory care as well. Assisted living is truly that next level, as I mentioned. We're moving away from the supports that we need throughout our day, such as laundry service, cleaning services, household items, and looking into more of the care aspect of what our needs look like on a day-to-day basis. So within that retirement living community, you're going to see higher staffing to resident ratio. Our residents are requiring more touch points throughout their day. We're not looking to those household items, but more personal care aspects such as dressing, grooming, bathing, assistance with medication administration, incontinence management. So those touch points throughout one's day is going to be more significant when you get into more of a assisted living environment there. Am I echoing a bit? No? Okay, just me. For Sunrise, we are very lucky. We can truly say that we are an age-in-place community. And what I mean by that is as one continues to, through their journey of aging, as their care supports increase, we can support those individuals in our community into a palliative and end-of-life state there as well. That moves into really how are we able to support that? So we can really look at both perspectives from a physical standpoint and a cognitive standpoint. I'm going to stick towards the physical standpoint as I'm covering assisted living. So we're looking to those individuals who are now needing not only a one-person support, but maybe a two-person support or even a Hoyer lift support. And this is one who may not be weight-bearing anymore, or needing a little bit of additional assistance getting in out of bed in the morning and so forth there. So with that, we also provide supports with therapeutic diets, and for instance, whether that's thickened fluids or minced meats. And with that, our residents could maybe have had a stroke or maybe have a progression in their Parkinson's and require more of those therapeutic diets, or even need an assistance with dining or assistance with feed, as we may say there as well. So with that becomes, in terms of the level of care provided in our assisted living home, we're very lucky. Our residents can move into their preferred suite, one bedroom facing the water, and they can get that continuum care behind closed doors. They don't need to move to a specific environment or another floor. They can remain in suite as we continue to add in those supports as one needs within our community there. Another big difference when you go from more of the independent supportive environments to the assisted living environments is we turned it into more of an inclusive rates rather than an a la carte rate. So we look at our residents and what are their day-to-day needs, and how can we support that. You may hear, you get half an hour in the morning support and half an hour in the evening support, but we cater it a little bit differently. As we know, our routines can change. That dressing, grooming, bathing in the morning can take half an hour one day and 45 minutes the next, and our residents' pricing does not change for that matter. As I mentioned, a lot more touch points throughout their day as well, as we have that difference in staffing to resident ratio. So that's kind of really in a whole of what sets us apart as that assisted living environment. Again, that next level from our independent supportive communities into more of that age-in-place environment there. In terms of really what our best suited residents are, I'm going to say residents, not clients, is as I mentioned, those that are really requiring our supports with their care needs of daily living, not necessarily their daily living tasks. We're looking at now our homes are really not, they're not accessible anymore. And I'm not necessarily saying those stairs, those dreaded stairs, as we all worry there might be a falls or a tripping hazard there. I'm talking about the environment themselves. You know, you're adding in supports from external caregivers or from home and community care support. And as we know, they may not show up on time, or what if they call in sick and you know your loved one truly needs that 24-hour care support. That's when we would look to our residents transitioning into more of an assisted living environment there, which kind of leads to the 24-hour care. Peace of mind, not only for you, but for your loved one, that there's 24-hour PSW and nursing support within an assisted living environment. For instance, we have what we call designated care managers. So they are trained staff by Sunrise. It's continuity for our residents, that they work with the same residents every day. So you're going to see the same faces in the morning and the same faces in the evening, which is super important, especially when supporting one's private care there. Other ways, there are other residents that we do have is those who have maybe been in hospital, you know, when they went in with a fall or, you know, an infection of some sort, and they've deconditioned to the extent of now requiring more support throughout their day-to-day. So that could look like a short-term trial as they continue to recover in hopes to go back home, or they could transition to us with requiring that additional level of care. As mentioned before, it can be transitional as well. We know those long-term care wait lists are quite lengthy, and we don't have that magic ball to know what the time frame will look like. So again, peace of mind that our residents can stay with us until that bed comes available and they're safe and they're getting the care or continuum care that they need. And lastly, for us, it's short-term stays. It's whether it's a 30-day or it's a lighter terminology for showing what a day in the life would look like in a community or in a community setting. So that's another way that we do have our residents join us there. And I know we are an assisted living home, but many of the time we do have individuals who are independent and they want to make that move once and they never want to have to make it again. So we do have those individuals who again are able to stay with us right into palliative and end of life there. So again, that's a little bit of a blip when it comes to assisted living. As you mentioned, there's so much more to give. So any questions or concerns, please don't hesitate.
Thank you, Sarah. One thing I just want to mention, what I see in my business is that many people end up in a crisis where there wasn't a need to get to a crisis. What I'm saying is you need to look at your comorbidities or any of your diagnoses and imagine what that's going to look like 5 years from now. So if you have been diagnosed with Parkinson's, you're not going to move into an independent living building. And I'm looking at you and I'm saying they're not at the end of the day going to manage that higher level of care if you only want to move once. So you really got to think about what maybe you've got as a comorbidity. Do you have diabetes? Not that that's a big deal, but there's certain things that will inform us of what things might look like 5 years down the road. So that's why I wanted to bring up the different levels of care, because you should really be thinking many people can manage quite well in independent supported living until end of life. But then there's others that have comorbidities, whether it be arthritis, an autoimmune disease, Parkinson's is a big one, dementia. Well, you're going to need a higher level of care. And I wanted to bring this to your attention because that's what I see happening. People think retirement living, they move in, and they only realize at some stage when management comes to them and says, you'll need to get one-to-one support because we can't manage this higher level of care and support, okay? So that's why I've broken it down into all of these different types. I want to bring this to your attention. So the next person I'm gonna introduce is Lauren Campton from Memory and Company. As Sarah mentioned, at Sunrise, they do an excellent job of memory living. However, Memory and Company is a lot different than what you would imagine as retirement living. It doesn't look like retirement living, it's not set up in the same way, but it provides a high level of stimulation. I'm gonna let Lauren tell you the rest.
Thanks, Jeanette. I'm Lauren. I'm from Memory and Company. We're located in Oakville. We've been there for 2 years. We have another location in Markham that's been there for 7 years. So we are a bit different, like Jeanette said, in the sense that we are entirely memory care focused. So everything that we do, the design of the club, the training of all of the staff are completely geared towards those living with memory loss, whether that's from dementia, Alzheimer's, Parkinson's, from a stroke, any type of variety of memory loss. So we are a retirement home. We do report to the RHRA, and we can provide long-term care up until end of life. So similar to Sarah's assisted living at Sunrise, there wouldn't be a need for somebody to move out of the home. We do 2-person transfers, full feed, full incontinence, but we also provide entry-level memory care as well, and that's provided through our day program. So we are a private day program that we offer, which is 7 days a week, all day, every day, 365 days a year. And that can be anything from 1 day as needed, you know, somebody's a big golfer and you want to bring your loved one for 1 day, or on a regular routine as well. So if you want to do 1 day a week, 5 days a week, to get into that routine for the family and for the individual who's coming as well. We also offer short-term respite. So it's a little bit of everything, which is a 3-night stay, and then, as mentioned, all the way up to long-term. So it's really flexible for those that might be a little bit more intimidated and want to do like a trial or an entry-level type of stay, all the way up to your end of life. So whether somebody comes just for the day or you come and live at Memory and Company long-term, it's all inclusive. So we have a minimum of a 5-to-1 staffing ratio. Our own doctor, we have 24/7 nursing, we bring in foot care, we bring in a dentist, blood work, everything. It's a one-stop shop, and like I mentioned, that's if somebody's just visiting for the day or lives with us long-term. So all of somebody's memory care needs are there on site, as it might get a little bit more challenging to go out into the community, and we just want to make sure that everything's there and it's all included. So similarly said, there's no a la carte system there in place. The way we operate is more of a family style. So you're not coming and looking for that 2-bedroom suite with a kitchenette. You're really looking to come to Memory and Company because you need that next level of engagement in an appropriate environment. So maybe you're at a retirement home and you can't keep up with that level of recreation that's going on, or there might be exit seeking, so they're not really safe in that type of environment. So you would come to Memory and Company where it's much more catered to where somebody may be cognitively. So for the whole day, you're typically out of your room and engaging with others in that family style, similar and comparable to a group home, versus being in your room and coming down for your meal, being in your room and coming down for 5 o'clock bingo. We really go through the day together. And then the other point that I was going to bring was our external care providers that include specialists, dentists, the GP, blood work, mobile imaging, everything's there on site. So quite small, we're 35 suites in Oakville, family style and very boutique living and environment.
Thanks, Lauren.
Yeah.
One of the things I would actually add to that is that sadly there's an increase in early onset of dementia. And I find when I'm working with families that have a younger person, and it's very sad to see, but we see people in like their 60s getting early onset of Alzheimer's. And if you take them to one of like a Sunrise or something, they don't seem to have a good reaction because they don't see themselves as old. They don't see themselves belonging to this group that may be in retirement living. So one of the things that I have had great success is bringing those that have early onset and they're much younger into an environment like Memory and Company, because it looks like a fancy club. It does not look anything like retirement living. So in those situations, it works very well, and we have a lot less resistance. And Lauren, I have a client there that's over 100, and yet I have a client there that ended up there because of Parkinson's. Well, no, actually more like Lewy body, I suppose. And he was 65. So there is a large spectrum, but you go in there and it brings me joy when I go to visit Memory and Company, because you see everybody is engaging and they're not just sitting in a chair doing nothing or watching TV. There is interaction all day long, and they go to bed and they fall asleep on their own because they're tired, because they've had a big day. So thank you, Lauren.
Of course, thank you.
Okay. Oh,
So we're on Iroquois Shore Road, which is Trafalgar and the QEW.
yeah, Lauren is going to be available after our lovely Paul Sharman, our councillor, has this opportunity to tell you about PACE. Then you'll have an opportunity to ask any one of our panelists a question. Okay? So just hold on for one more moment, and we'll let Paul go ahead.
So I'm going to do my own introduction, am I? Well, good afternoon, everybody. It is a wonderful pleasure to be here. I have to tell you I'm a senior. I have a question for you all. How many of you are looking forward to going into long-term care? Oh, look at all the hands going up. Well, there's the answer, right? Nobody wants to go into long-term care. Did you know that 70% of all the people in long-term care in Canada do not have a health care problem? They are there for a whole bunch of other reasons. What I'm here to talk about is a program of all-inclusive care for the elderly, and I'm pleased to have Lindsey here. My colleague Vipan Nikor is the owner of her business. And I can tell you, sir, with respect to your question about the reputation, Vipan Nikor, look him up. He is one of the most powerful educators and medical persons in Ontario, and he has my utmost confidence, I can tell you. That said, the roots of Vipan and HomeCare Hub is PACE. It comes out of the United States. It's in 30 states in the United States. Has about 40,000, 45,000 community members across those 30 states. It was started up in San Francisco, in Chinatown. And the reason it was started up in Chinatown in 1973 is because the people who were living there did not speak English and they could not get health care. Bit of a problem, right? So we'll talk more about that as we move on. So the notion of health PACE is basically integrated health and wellness services to keep people well in their own homes. Okay? So the existing healthcare system we have was invented in the Middle Ages in war. What would happen is somebody get an arrow in their chest, and a medic would run over and go, "Oh, look, you got an arrow in your chest. Let me take that out." They'd take the arrow out. And then after that, they say, "Good luck." Right? Our medical system is a result of everything that should have been done in the community that has not been done. We can change that. That's the goal of PACE. My goal, my involvement with this, by the way, I have to introduce my daughter Jennifer, who's sitting in the back. She gets angry when I tell you how long I've known her, so I won't, right? I won't do that. But anyway, it's great to have her here this afternoon, so thank you for having Jennifer here, Marion. I wanted to start off by just briefly saying that along the journey I have had, the most important motive for me being here today is my mother. And my mother, who passed in 2015, had about 10 years earlier developed certain problems associated with paranoia and a number of other things, and she was unable to cope in her home. We took her to a seniors doctor who put her on pills, and within 2 days she was catatonic. It took us 6 months to get her back to nurse her back to a state of ability to do some things, but not much. We subsequently moved her into an apartment in my sister's house, and she was able to stay there for a year, but gradually became clear she could not stay there. So we put her on. We asked her if she'd like to go on holiday in a retirement home, and for the first week, and afterwards she said, "I love that place. I'd like to go back," and that was great. We were able to place her there until one Earth Day. The lights were put out at night in the evening because it was Earth Day. 1 hour later, Mum was disoriented when the lights came on. Somebody approached her, and Mum was uncomfortable with that. She pushed her. Now, Mum was not a big, strong person, but she was deemed violent. And they then demanded that we take her out of that home and put her in long-term care. And where did they put her? Into a locked ward, where they had a lot of young people, young men who were abusing many of their members. It was a disgrace. It took us years to get her out of there. Subsequently, Jennifer and I, my daughter, started up a program of trying to build self-help groups in Burlington, a number of different properties, where we got groups of seniors to work together to improve their quality of life. And we were just about to set that up as a program with CCAH at the time, just before they went bankrupt. So we got taken apart by the province, and we then then ended that journey. But a few years later, remember Rick Goldring? Anybody remember Rick Goldring? Mayor Rick Goldring? He and I were invited down to Detroit to go to see the United Methodist and Presbyterian Villages properties down there, because it was run by a friend of mine. He was the chair of it. In the lower level of these properties, 5,000 units, they had this thing called Program of All-Inclusive Care for the Elderly, 360-degree wraparound services. Every member of PACE is already nursing care eligible in the United States. They keep people well, funded by Medicare and Medicaid, for as long as they are able to cope in that environment, and that's mostly. They have significant numbers of people who are actually, really, we would have, with our Ontario government and Canada would put them into long-term care. They keep them in their own units. Right? PACE in many of the states operates as an independent building without housing associated with it, and they provide services to people in the community. We have a member of our group which is called Coalition of the Willing. Vipan Nikur is a member of our Coalition of the Willing. We also have the Heritage Francophone buildings and development in downtown Toronto. They have a 180-unit building. It's Francophone, it's independent, it's operated by Francophones, for Francophones. They service with a PACE-like service in that building. It also serves Francophones who live within 2 kilometers or more in Toronto area with those PACE services. So it's not just in the building, it can be in your own home. We brought this idea back here in this very room in 2017, November the 8th. I held a workshop with about 80 people, all community leaders. I banned politicians from the room except myself and Rick Goldring. And what we asked for was a team of leaders from the community, including the hospital president, you remember Eric Vanderwall, the chair of the hospital. We had folks from the region, staff, and we went through a whole discussion about PACE. At the end of the presentation, I stood at the front and I came back and said, okay, everybody, what do you think? Does anybody in this room think we do not need PACE in Burlington? Right, it's just like you right now, silence. And at the end of it, somebody said, so what are you going to do about it, Paul? The answer is we've done it. We had, from that date, we then began to work on building the first PACE pilot program in Canada, here in Burlington, and that is now done. 410 John, you know what John Street is, the bus stop? Right there, there's a Community Housing Corporation building. I'm president of the whole Community Housing Corporation, which helps. And we were able to put a PACE center in there. We opened that in 2020. It's now been operating for 3 years. We are now scaled up to 3 centers in Halton, and we're building the first custom-built PACE center in Canada, in Oakville. The whole purpose of PACE is basically that we want to keep seniors who are at risk of hospitalization and institutional care living healthy and happy at home for as long as possible. Does that resonate?
Yeah.
Right, I don't want to go anywhere, I can stay at home, help me do that. To offer care and support through trusting relationships and integrated approach that proactively identifies and responds to physical, mental, social flags before individuals get into crisis where they require acute care resources. Our job is to keep you out of healthcare systems, right? Our job is to make sure that our community lives well and long without having to work within the hospital system that was proven during COVID to not be able to cope with the number of people we have already over the age of 85. 85% of all hospital patients are over the age of 85. Which says, you know, we've got to worry about that when we couldn't even cope with that. That number's going to double in the next 20 years. So I think I'm getting pretty close to my time, am I? Am I getting there? Am I getting the hook?
I got my eye.
All right. We offer all the services that you would need under the Ontario healthcare system. So, and if you get to that point where you're registered, we can organize those. The way we organize all these services is through a role called the coordinator. We have a coordinator, you become a member, you're not a patient. We're not even going to call you a patient, right? You're just a human being. Right now our pilot projects are in supported living, seniors housing. That is not a retirement home. The Francophone one in downtown Toronto is also seniors housing, it's not a retirement home. In that home, they have a number of people, about a third of those folks who are already long-term care eligible, and they have no need to go into long-term care. They can reach end of life there. In Mississauga, they have 80 community buildings. They have something called Peel Seniors Link. They have a similar experience with looking after people already registered who live in those buildings, and they can look after them for all the time they're in that building. They get phone calls from the Ontario government saying, when are you going to send those people to long-term care? And the answer is, we're not. We're keeping them here because we can look after them. That is PACE. I'm going to end up very quickly on this. The cost of the coordinator is $3 a day per person. When you live in your own home, there's no hospital to pay for, and there's no retirement home, and there's no long-term care to pay for. So the cost of providing service, as Lindsey said, is dramatically cheaper for the entire community for you to live at home and get the care you need at home. So $3 a day for a coordinator, works with an interdisciplinary team, and that way we can look after you for the rest of your life, most likely. We are at the first stage right now. We're now seeing it being implemented in places like Oshawa, places like Ajax. I was speaking to the Ajax Council last week. They want a PACE centre. I'm involved with another one going in Scugog. We're at that point. We're almost at that point where we're going to scale up. My goal is 1 million person PACE capacity in the next 10 years and 2 million across Canada in the next 20 years, because you and I are getting there. I invite you to work with me to scale and spread PACE, to advocate it to anybody you can, and let's get there. Thank you.
Sorry? No, you're bang on. You're good. Thank you. So, I keep getting told to move over, so I don't want to block Marion, but I was. Anyways, so you've heard a lot of information, and really my point of today was really to have you think outside the box, that we're not going to all go to retirement living, we're not going to go to long-term care, hopefully. And if those that don't need long-term care don't go there, then there may be room for those that actually really require it. So that's really what the whole point of this was today. No, I didn't represent every single retirement living community out there, but that really wasn't what I was trying to accomplish. I wanted you to think outside the box. I wanted you to think about other options, because we're all unique. We all want something different, and we're all have different challenges. And some of that is income, some of that is health, some of that is cognitive, a whole variety of things. So there has to be a whole variety of options, and that's what I'm all about. So, who has questions? Okay, I'm going to start with this lovely lady in the front with the red jacket. I'm going to come over with the microphone.
Since you're the most recent in my memory, do you have a website? How do people get registered? Is it, if people are wanting social connection, do they then move over to what you were showing them?
Okay, so thank you very much for the question. It's an excellent question. We are very early in this process. We are presently creating PACE programs in community housing corporation buildings. And we have, in Holland, we have about 40 buildings, of which about maybe 8 are for seniors. My current project then is to take it into privately built retirement homes, but specifically seniors living, not registered retirement homes. So very specifically, then we are just beginning to see that happening. But with respect to HomeCare Hub, you could actually talk to Lindsey, and she will give you the services immediately. And we will see that. For those of you who aren't and don't need community housing, and that's probably only about 10% of the community, and the other 8% live in Schlegel or places like that, right? There's about 80% of the rest of us who depend on Google, right? So really what we have to do is depend on organized, supportive services that are available to you already through organizations like HomeCare Hub. There are also services like that in Burlington and Oakville today.
Someone would recommend to you.
Yes, send me an email.
Someone would recommend, well, they would be recommended by
Well, I can
services?
Yeah, I'd have to give you some names of those kind of organizations. You can also register with the Burlington, Ontario Health Team. And you can go onto their website and it will give you the information.
Or Caroline Clinic will.
That too.
Yeah.
Right, go to those organizations.
Okay.
Thank you.
Thank you so much, Paul. Ken has a question.
This is for Paul, please. Paul, $3 a day is a very attractive selling point. How do you do your funding?
So $3 a day is presently for the community coordinator in Halton Community Housing buildings. To some degree, it's being funded already by the housing communities, HCAH or
HCCSS.
In other words, the government. But in Halton, we've actually been funding it through the Halton Community Housing Corporation. What we see as we move into private housing, it would be $90 a month added on to your bill. But that would give you somebody who would take care of your every need with your work. I mean, they wouldn't tell you anything. You register, you work with them, you give the care you need, and they would guide you to all the services you need. That help? Thank you.
Okay. Okay, I've got a question at the back here.
That's okay, I can talk really loud.
Excellent.
Councillor Sharman, but that $90 a month, that's for the administrator, but if they say, well, we can hook you up with a claim, you're still having to pay for the acclaimed services.
It depends on your status.
Okay.
So if you're registered, then you get the service. What we free through OHIP. What we have discovered is that the community coordinator, the coordinator, has made a claim and Thrive more efficient and effective. And what happens is the service you will get in your own home, instead of being a random service provider who could be different every day, with the coordinator you get the same person all the time.
So I guess my question is, above the $90, is there any additional cost to you?
If you are paying for services, going on Google, trying to find somebody to help solve your problem, it will be the same as that you would pay for your services. If you are on the register, if you're registered, then you will get the services as would anybody on through OHIP.
Okay.
So I'm just asking, are we circumventing the government services?
Can you repeat that louder?
The question was, are we circumventing government services? The answer is, for those who are on the registry, no, we're using the government provides paid for services through the same service providers. We're just organizing them. That's the critical issue. We are organizing them. Once you get out of that registration list, then you're on your own, you're paying for your own housing, you're paying for your own services. What we can then do is make sure that you get the services you need when you need them. I didn't tell you that what we have found at 410 John is that we have a 50% reduction in the EMS demand. We have 74% improvement in mental wellness and other aspects of our living. So the payback is dramatic.
Okay. I see another question over here.
So it sounds like PACE is something that is being done here in Burlington or Halton. Is this something that is being done in Hamilton? I come from Dundas.
At the moment, we know that the Hamilton OHT is beginning 2 programs, 2 buildings. We're all experimenting. We're just at that scale-up stage, but there are 2 buildings that I'm hearing are coming online in the near future in Hamilton. We're also seeing it happening elsewhere. I was just asked today to go out to Peterborough to meet the Housing Corporation folks in Peterborough sometime in the next month, and there are many options like that. It's coming. It's just not now. We need it quickly, right?
Thank you, Paul. Have one here for Lindsey.
Has the HomeCare Hub established homes in the Burlington area? And is there any way that we can visit?
So we have homes throughout sort of the GTA from Hamilton to Scarborough generally. We don't have one that's available for touring right now in Burlington. We do have partners so that we could have one available in a month, sort of, you know, if we had the demand for it. If you wanted to tour, the closest one to here would be in Hamilton, and that we could arrange a tour anytime.
Okay, but you've not established anything here, even though I can't visit, for instance.
So
is anything established in Burlington already?
We don't have an existing home that's here right now. So like I said, we could open one in about a month because of the arrangements that we have and our developer partners. We're just waiting on the 4 people, 5 people, you know, whatever it is, who need that here, and then we turn it on.
Okay, thank you. I might have 4 people.
That's what they want to hear. Because it doesn't make any sense for them to go out and buy all these properties all over if the need's not there. So they wait to see where's the need, and then let's be very cohesive about the way that we establish these homes. Go ahead.
Right. And that was what I was about to say, is that yes, if you think you have somebody, you may need this sort of assistance, something like that, I would always encourage you to give us a call. We have a form that you can fill out online if you prefer that. Because again, you know, you may not know that we have 3 other people and we're just waiting for that 4th or whatever, right? And so yeah, if you give us the information, it doesn't take us long to kind of turn it around.
Thank you, Lindsey. I have a question here for Paul.
Hi, Paul. I live in Burlington, but I feel like it's an abyss between Hamilton and Halton, and we don't quite belong anywhere. And I find myself using some of the services available, but being totally overwhelmed and confused because I can't access things like some of the home care things, because I have to have what HHCS provides and their company. I have no choice. So if you go with the PACE program, does the coordinator then take away from those Hamilton things that I'm forced to have and put you into Halton things, which in many cases seem to be better?
So you said you live in Burlington?
I do.
Okay, so the Burlington, Ontario Health Team is standalone. It is part of the Haldeman Group, but it is independent. Haldeman includes Hamilton and Niagara, but includes Burlington. But we've managed to carve off Burlington so we can stand on our own 2 feet. So if you were to go on the Burlington Ontario Health Team website, BOHT website, that will lead you then to the Burlington environment. That said, if you live in your own home and you're looking for support services today, Certainly Lindsey's organisation is ready and available. There are others in Burlington. So Lindsey from the HomeCare Hub, if you're looking for HomeCare, and I realise we have other people in the room who don't provide these services. Right now, we are not in the Holt Community Housing Corporation is not yet ready to provide services to those who live around the area of 410 John, but it's coming, so we're just beginning to scale up.
Thank you, Paul. Any other questions? Okay. And who's this for?
There actually was a question here on the panel that I realized I might perhaps should clarify. So the focus of our organization that we're talking about here today is the sort of shared care homes. But another thing that we do, we also have a network that provides in-home care. I didn't even talk about it, but we have between 50 and 100 vetted home care agencies, existing home care agencies that we have vetted. And so we're able to access care, in-home care for people who need it. So I think that's something that just might have been missed there.
This is for Paul. I've been trying to talk to people through the Alton Community Services because I live in Burlington. Burlington is not part of Halton Community Care Access at all. I've been transferred through to Hamilton because Joe Brand is Hamilton Health Sciences, even though it's Burlington, Texas. It is totally separate from Halton. So he keeps saying he's Halton Care, that they're not. I get put through to the Halderman, Hamilton, whatever, because they take.
So I'm sorry to hear that, and thank you for telling me. Do you have email? Do you use email?
Yes.
Could I ask you please send me an email, paul.sharman@burlington.ca, and I will ask our 311 people to get their act together.
Okay, because I
We will fix that. That is entirely wrong.
Oh, I agree, because now I've got Hamilton.
Well, we are, but the BOHT, we have BOHT, and you are in the catchment area for BOHT, and you should be contacting those people. So I appreciate this, the Holden housing thing, but I think we should fix that. Leave it with me.
It's all based on postal code,
I understand.
and we are Hamilton, and we can't get the service from
No, I do understand, but we have a separate Burlington, Ontario health team, of which you are by definition part of the capture area. That is different from the Haldeman other thing that we were talking about, and we can have that conversation, but I do have some abilities to enforce things like that.
So Paul, I just want to clarify, because I know a number of people in the room are all looking at each other, what is happening here? So.
Yes, I get, we're talking about two different things, but we need to have one point of contact for people in Burlington, and it should be the BOHT.
Okay, so it should be the BOHT, because as we know, the Ontario health teams are broken up into a variety of, I don't know, what is it now, seven different areas. And she's right, in Burlington, you fall within the Haldeman, Hamilton, and it's very confusing, right? It's very confusing to me. I get questions about it all the time. So what you're saying is that anyone living in Burlington should go to the BOHT.
Burlington's Ontario Health Team. They have a website, and we've got our own president here, Kathy Peters, and we will have that conversation.
I think that's an area that needs to be better advertised.
Well, apparently needs to be dealt with.
Yes, it does.
Give me a chance. Everybody send me an email.
Okay, so let's move on from Paul. Does anyone have any other, another question?
It's just a suggestion. Marion, could you send out, you send us all information and invitations, a list of the websites or connections to ask the people that are coming here, because I can't write that fast. I have hearing difficulties, and it really would be helpful if you could send out the link to Lindsey and.
So actually, so their email, or their.
Can you use the mic?
Can't hear you.
On the back of today's handout, the white ones, there's phone numbers of today's panelists. However, we had Mohammed, so Lindsay's got some other information. But if we contact him.
If you contact Mohammed, he'll get you with me. Don't worry.
So the same, so all that, there's phone numbers and email addresses for these panelists. On the back of the handout, for Jeanette is on the front of the handout, for everyone else that's here today. All that information is there. But while I have the microphone, can I ask a question? So, just in terms of independent living and supportive living and assisted living, so you can go into an independent living home and advance through the system or move along. Some homes offer more supportive and more assisted living. So where do we draw the line? How do we know where to start or where to just sort of jump the queue and go into?
I'm going to answer that to a certain degree. Because when I go out to do assessments.
Can you go to the front?
Sure. Thank you, Director. So let me kind of, when I go out to do assessments with individuals in their homes, and I'm trying to determine whether or not they need independent supportive living or assisted living, it does come down to mobility, I would say, has a big impact. So if that person is spending more time in bed and not getting up and about, having difficulty toileting themselves, needs more, like to Sarah's point, touch points, then they're not necessarily going to do so great in independent supportive living because the staffing models won't allow for those additional touch points. So that's where I say, and also another thing I didn't mention before, but you should consider, don't wait until you need assisted living to go into retirement living. People wait too long and then they come to me and they say, I need an assisted living bed. And I say, okay, great, let me start calling partners. Their assisted living beds are fewer than there are independent living. So you might have a floor of, 28 suites in some cases on an assisted living floor out of 130 suites. So the people internally that have been aging in place are going to be given priority over those assisted living beds or memory living beds from the people that are internally already there. They're already calling that community their home. So then when I'm looking for an assisted living bed, I might have to call 5 or 6 places in order to find that elusive assisted living bed because there's more need than there is availability. And I would say the same for memory living. So if you start to see some cognitive decline and your parent or loved one is in an independent living, start to have those conversations with the director of care so you have a good and better understanding of what timelines you're looking at. So stay on top of it. Don't close your eyes and hope that it's all going to go away, because I can promise you it's not going to go away. It's just going to get bigger, let's just say. Sorry.
Assisted living places will not take someone who's getting that assistance from a retirement.
Okay.
Can you
A lot
repeat
of
that a bit
people-
louder? Can you repeat the question?
Yeah.
Some I don't know all, but some assisted living places will not take a person in if they're getting all their assistance when they're in a retirement home.
Okay, so we're using terminology. We've got to clear up some terminology. So, Sometimes people think assisted living is long-term care. It is, but there's also private assisted living within a retirement living community. Do we understand that? So sometimes long-term care is referred to as assisted living. Long-term care is publicly funded or subsidized, and we don't get to decide when we go, we only get to decide if we want to go, okay? So think about long-term care, you don't get to decide when you go, where you go. You only get to decide if you want to go.
And availability.
Yeah, there's no availability right now in long-term care. So therefore, many people are opting for a private care model, which could be HomeCare Hub, or it could be private retirement living. And in private retirement living, they offer independent supportive living, assisted living, and memory care, okay? So most people, right now, it is taking anywhere between 8 months, a year, on a crisis list to get into long-term care, okay? That's why many more people are either bringing care into their home to manage, or they're using one of these other options, okay? And the problem is cost. So that's why I brought Lindsey here to talk to you about HomeCare Hub, because it is another alternative. If you don't want to leave your home, she can also talk to you about another option, which we haven't touched on today. Just know that HomeCare Hub does a variety of different things. If you need care to come to your home, or maybe it's just check-ins. You need someone to check in. They charge a certain pricing, and will send people to your home to check in. And that pricing can be anywhere from $18 a day, or is that low? That's really low.
So if you're talking about wanting to like hire a caregiver to come into your own home, so that we either do through our own internal caregivers or vetted agencies, that is more expensive. It's typically the average in this region is probably low to like $30 to $35 an hour is the cost for like in-home care.
Yes.
Yeah.
I'm gonna confuse everybody if I go down this road, so we're just gonna stop.
Yeah.
We're not gonna go down that road today. We'll go down that road another day. But does everybody understand the difference between retirement living, just say it out loud, retirement living, private pay, long-term care, government subsidized? Because it's government subsidized, we have to share. And therefore, they decide who's at the highest needs and requires it.
So back to your question, you said that they're being declined or denied because your assisted living is being declined. But they're being declined from long-term care if they're in someplace else, not declined from a private home. A private retirement residence.
No, if you're in a retirement living home, that's considered your private home. You would not be overlooked by long-term care just because you were in retirement living. It's considered your private home, okay? So you could not be denied long-term care even if your home is in retirement living, okay? Because you're paying for that. And honestly, I have seen people run out of money at 95, 96. So, no, you cannot be denied long-term care if you're in retirement. Okay? Are we good with that? Okay. All right. Your question.
You mentioned money, finally. Good for you. You won't do it today, but it would be really helpful if at some time you could organize your financial people to lay out all of the different levels, you know, when you're on a cruise, you either go steerage or you can help your figure it out. It would be very helpful. I'm not being facetious about this. So it can balance our economics with our financial plans. Do you think that's possible for the real estate fringe of people to put that together?
Actually, that's something that I do for my clients because they come to me with a budget. And I'm all about budgets. So you come to me with a budget and I'll be able to help you figure out what level or which one of these lovely people might be able to help you, or if there's something else. Okay? It's complicated. It's really complicated. That's why we're doing these.
I saw a few people were wondering how to get a hold of Jeanette. She's on the front of your page, not on the back. So her contact info is right there at the top of the front of the white page.
Thank you. Does anyone, oh, I see another question at the back.
With all these services you're obviously presenting to us, if somebody's just on low income, how are they going to be able to afford any of it? I know assisted living is very expensive.
Well, I'm sure Paula's going to talk about this, but I would also say, the best advice I could give you is to get on those senior supportive housing lists. Because I'm not sure in Burlington, Paul, but I know that in Mississauga, it's a 5-year wait. So get yourself, if you are low income, get yourself on all of the supportive housing lists that you can. And choose a long-term care, choose your 5 long-term care homes. Yeah, but get on the senior supportive housing list, because they do take some time, but they can be helpful. Yes, Paul?
Yeah, I was going to add to that. This is a horrifying situation. We had a family member, my partner's sister, who had been in an apartment in Hamilton. She badly needed to move into assisted housing. Their mother had lived at 410 John many years ago. I'm president of Halton Community Housing. I could not get Jen and sister moved to Burlington into assisted housing. We have 2,200 units. We have a waiting list of 6,400. And it gets worse when you go to other jurisdictions. We are relatively better off than many places. So I feel I hear this story all the time. It's horrifying, and there's no quick fix. All I can suggest is you talk to our our social services department, and you can call 311. And you can ask if there are any support services. I'm not aware of what that would look like, but they do have help.
Anyone else? No more questions? I'm shocked. One at the back. I've got some questions that I'd like to ask, if I may, and then I'll come back to you because I'd like to get involvement from some of these other lovely ladies here. Okay. So, Kim, what are some additional service options for independent living at Vistamere?
Okay, so retirement homes, they offer a spectrum of services. So from independent living to assisted care, so opting for a move while still self-reliant allows individuals to settle into a vibrant community at their own pace. It's a chance to embrace a lifestyle focused on social engagement, activities, and enjoying life without the responsibility of home ownership.
Okay, thanks, Kim. Lauren, let me ask you this. How does one know they are ready for memory living at Memory and Company?
Thanks, Jeanette. So a good time to maybe consider memory care living is if you're having challenges keeping up with your current community as far as the recreational programs or having to add on an extra external services. So maybe more companionship, more help when it comes to assistance of daily living, or you might be wandering, so you need a more secure environment, getting ready for the day and evenings. Somebody looking for a more appropriate environment that they're able to engage in. And as well, Memory and Company is definitely more suited for those looking for an active lifestyle, regardless of their cognitive ability. Because we have more of that group home setting, it's definitely suited to those that have a busier mentality and active lifestyle, regardless of where you are cognitively.
Thanks, Lauren. I have one question at the back here.
Just for Vistamere, I'm wondering what the waiting period would be to get a place.
That's a good question. So you're gonna find that most retirement homes like Vistamere that offer independent supportive living will have availability month to month. So there's, the only time that there's gonna be a waiting list is if somebody specifically, let's say, lives with us already and is waiting to move from a 2-bedroom to a 1-bedroom internally. That's where you kind of see more of the waiting list, or somebody wants to wait to move into the home because they're waiting for a specific size or type.
Thank you so much, Kim. Anyone else? Oh.
I'm curious as to how it works. If you want to give up your home and move into a retirement home, but you're only going to be there 6 months of the year, what happens then? Because when you go in, you're paying for your meals and all of the rest of it. What happens to people who are just not going to be there for half a year?
Yeah, that's a great question. So we will work with families and residents who live with us that maybe are snowbirds, that go to Florida for 6 months out of the year, where you'll pay your rental portion, which is 60% of the cost. And they'll, every home's gonna be different though, so you would have to talk with the management team there and get an idea of what they can offer you for being away for that length of time. We do waive some of the services when somebody is away, especially if they land in hospital for care reasons and aren't coming back for more than a month's time, things like that. But yes, things can be arranged.
Yeah, so that brings up a good point, actually. So sometimes, well, more than sometimes, I suppose, people will be residents in a retirement living, and then something will happen, they'll have to go to hospital. If they're away from the community for any length of time, you should be contacting them to find out if they've reduced or removed your meal portion, your care portion, services portion to your rent. So at least while you're in hospital, because you're not receiving those pieces, that they could reduce the rent during that period of time that you're absent from the community. Okay? Anybody have anything else? I think we're just about done. It's 3 o'clock. Oh, one more. Okay.
I can talk loud.
No. No.
I just wanted Vistamere, if you could tell us what your lowest rate is up to what the highest is, just to give us some idea of what we're talking about.
Of course I can. So in retirement living, there we go. Now everybody can see me, all right. So with retirement living, we offer a range of different types of suites, from a studio to a 2-bedroom, and they'll range in square footages. So the costs are going to be based on your square footage. So the smallest square footage we offer is 419 square feet, and it's a starting rate of $35.95. Okay.
A month?
Sure. So I had the request was if Sarah from Sunrise and Lauren from Memory and Company can provide sort of your entry level price range, and what it can go to.
That's okay. Yeah, so our average, we have a lot more, again, with the inclusive rates, so all of our amenities, we add in, you know, meds, we add in a shower, we add in those things as well. So for our studios, you're looking about 58 to 6,200 for 430 square feet. Yeah. One bedroom, there's not that much of a difference, it's just based on square feet. So we have 3 different levels of studio and 3 different levels of our one bedroom, so it can range from 62 to 68.
One of the things I just want to mention, you're going to see a range of pricing, and oftentimes that is based on their staffing levels or their ratios. So if you've got a 5-to-1 staffing ratio, certainly that cost is going to be much higher than if you have a, let's say, 20-to-1 staffing ratio. Okay? So that's something to keep in mind.
Okay, so for Memory and Company, you are going to see a significant jump. You're looking at around $10,000 a month for memory care living. Keep in mind that individuals who live in memory care require queuing, guidance, and reminders, essentially for everything that they do throughout the day. So there's a much, much higher level of support that is needed, and individuals are essentially with staff and with their peers for the entire day. There's not a lot of independence left by the time that we're all together.
Good. And that is where our memory care starts as well, so it's very similar.
Just don't get discouraged. These I brought both Sarah and Lauren in to talk about their communities and the differences. But just so you know, I mean, you can get memory living for much less than that. Recently in a discussion with somebody out in Scarborough, I understand it's not right here, but they're doing $4,000 a month for everything included, care, everything. But it's in literally a residential home with staffing. So that's where there are little nuggets like this around. I'm finding them more and more, and I'm putting them in my database because, to your point, I know, and so do all of us, know that not everybody can afford that level. And so there are other things, and that's exactly why I brought Lindsey today from HomeCare Hub, because they do offer an alternative, and they do have high levels of care. So,
yes, for our patients who are like 24/7 care, we're generally more like 6,000 instead of 10,000 on average. And you know, generally across the board, about 30% lower than the more institutional alternatives.
Yeah. So if you're interested in learning more, you have my number. You have all of their numbers. I really suggest you do some research and look to see what is available in your community, and go and take a look at all of the smaller independent options. Call Lindsey, find out more about HomeCare Hub. Certainly, I'm going to be keeping an eye on PACE, both here and in Oakville and other areas in Mississauga. But it is our job, all of our individual jobs, is to look at what we feel we might be best suited for, and then do your research. And if that means starting by a call to me, great. I'm always happy to help. Okay? Turning it over to you, Marion.
Thank you very much, Jeanette and all the panelists. I learned a lot today. I hope everyone has come away with some good tips and information. Certainly no shortage of learning to be had here today. Just before you head out, just again wanted to acknowledge and thank our educational partners. Again, we're all here for you at your disposal, and please do take advantage of the opportunity to speak with any of us. We couldn't do this without our educational partners. Thank you. And before you go, please do fill out the evaluations. Lately, I've been getting a lot of feedback in terms of the topics you'd like to have covered. These sessions are for you. They're not something that we're, just here standing up and saying you must need this information, you must know it. So we'll be responsive to your needs. Please let us know. We'll plan our schedule accordingly. The evaluations are very helpful. If you'd like, yes, sir.
According to recent sheets, the next session was on May the 8th, and it says May 10th up here.
It's the 8th. It's the 8th. Sorry, my error. That's me. Thank you for correcting that.
It's May 8th?
May 8th. May 8th. The topic of, we're going to have another fun discussion next month, death, dying, and navigating into life decisions. So you want to come back.
Getting old is so much fun.
If you wanted to register for that, you can do that with Lisa or Ina or online.